Imagine you're in an amotivated state. You're just not feeling motivated. You're procrastinating. You may think, okay, the thing to do here is something. I'll clean the house. I'll take care of some bills. I'll do something. Or I'll just wait. Those approaches, as we talked about before, generally don't work, or at least don't work quickly, or they lead you right up to the deadline, and that's the deadline that forces you to get something done, or you just don't get it done and you don't succeed in your goal. That happens a lot as well. However, if you were to take that state of being unmotivated, of procrastinating, and actually do something that's harder than being in that amotivated state, in other words, doing something that's more effortful, even painful, you can rebound yourself out of that dopamine trough much more quickly. So what do I mean you want to put yourself in a state that's worse than or harder than the state that you're in, or do something quote unquote more painful? And here I want to be very clear. I'll say this 3 times, but I'm going to say it for the first time now. When I say more painful, I do not mean doing any kind of tissue damaging or psychologically damaging behavior or anything of that sort that's going to render you injured or not well, even in the short term. That's not what I'm referring to, okay? Let's just get that one out of the way. What I'm referring to is the fact that, for instance, if you're feeling amotivated, but you find yourself cleaning the house as a way to procrastinate, you could say, well, cleaning the house is harder than sitting down and doing nothing. But actually, in that moment or in those moments, that's not the case, or else you wouldn't be doing it. The reality is that the dopamine system works according to what feels hard or easy in the moment. In other words, if you're feeling amotivated, you need to do something and put yourself into a state that's harder than the state you're in. So for instance, if you're sitting around feeling amotivated, or you find yourself tending to tasks that are irrelevant to the goal that you really should be focused on, you need to put your body and mind into a state of discomfort quickly. And the way to do that is to either engage in some tangential activity, meaning an activity not related to your goal that puts your body into a very different state. So here again, I'll default to the obvious one, which is something like cold shower or cold immersion, which not only increases dopamine long-term, or over several hours rather, but for most people is experienced as pain. That pain causes a rebound out of that dopamine trough faster than it would occur if you had just stayed in that amotivated state and waited for it to go away, or done something like cleaning up that for whatever reason felt like it required less friction. When I say friction, I mean limbic friction. Your limbic system is always in this dialogue with your forebrain. And limbic friction goes 2 ways. Limbic friction can be you're tired and you don't want to do something, and so you have to, quote unquote, motivate to do it, energize yourself to do it. Or limbic friction can be that you're nervous and scared and anxious to do something, and you have to calm yourself in order to lean forward into action in order to do that thing despite the anxiety. I realize this can be a little bit confusing as a concept, so I want to go into a bit more detail. Let's imagine that you or somebody else does not like to exercise. You don't want to exercise, and you're trying to get your minimum of 5 days per week exercise, and you're just not motivated to do it. There are a couple different techniques to doing this. Assuming you've taken care of all the baseline stuff, all the foundational stuff we talked about earlier, and you're just not getting in gear, and you find yourself, checking your phone, or maybe you're tending to some tasks. Obviously, those things are quote unquote easier for you, meaning they cause less limbic friction than engaging in exercise. The typical advice would be just exercise for 1 minute. Okay, just get 1 minute of exercise, or 5 minutes, and then use the successful completion of that 1 or 5 minutes as a milestone that allows you to then move to the next milestone. And indeed, that approach can work. And it's exactly what I'm describing here when I say that you're in a state of lack of motivation or procrastination or both, and you need to put yourself into a more painful, not less painful state. So what do? You push up against that friction and you exercise for a short while, and then that pops you out of that trough. That's possible, but for a lot of people, even that won't be possible because they just can't get motivated, or they do that 1 minute or 5 minutes and they're just like, okay, I'm still in the trough. I'm not actually feeling that great. In those circumstances, it makes sense to do something that's tangential to the whole path that you're trying to pursue, this goal that you're trying to pursue. That is, believe it or not, much worse than just being amotivated. And when I say worse, I don't mean picking some task that normally you don't like to do, but now you're willing to do. I mean, literally thinking about What would be worse than being in this state? Again, without causing yourself tissue or psychological damage. What would be worse? Well, cold water would be worse for many people, very cold water. So the key is to figure out something that, for lack of a better way to put it, really sucks, and yet is safe. And by doing that, you steepen the trough, you steepen the slope of the trough, which we know brings you back to your baseline level of dopamine more quickly. Now, for some people, that will be deliberate cold exposure through cold shower, ice bath. And I have to tell you that if you're cringing as I say this, well, then there you go. You now have a tool that you know you cringe even when you just think about, and therefore represents a great tool for you. So if I'm procrastinating to do something I really need to do, should I just simply wait for that procrastination to evaporate? No. Will it eventually evaporate? Maybe. Will a deadline eventually surface that will trigger me into an anxious or activated state that will allow me to complete what needs to be done? Maybe. Hopefully. But better would be to get out of that amotivated state, that state of procrastination, quickly. And to do so, you need to leverage something that's painful. So for instance, I heard a beautiful lecture recently done by Dr. Anna Lemke at Stanford School of Medicine discussing dopamine and some of the things in her book and some newer findings as well. And somebody in the audience asked her the question, does meditation increase dopamine? Classic forms of meditation, whether eyes open or eyes closed, so-called open monitoring or closed monitoring meditation, sitting there or lying there and focusing, does not increase dopamine levels per se. However, for most people, especially people who find it hard to meditate or who don't do that practice very often, meditation is effortful. Getting into meditation and staying in meditation is effortful. So if you find yourself in a state of procrastination, oftentimes a brief 5 to 10 minute meditation where you absolutely do not allow yourself to do anything besides close your eyes, focus on your breath, and when your mind drifts, get back to your breath, is not only extremely difficult and extremely frustrating, unless you're a well-practiced meditator, but it's often difficult and frustrating not just to do, but to get into that practice. And not just to get into that practice, but to maintain that practice for that mere 5 to 10 minutes, because it's just not a natural state for us to be in. We have to force ourselves. So it is effortful. In fact, it qualifies as a basically available almost anywhere, anytime type of effortful activity that if you dislike it, perhaps even as much as some people dislike deliberate cold exposure, well then, perfect. You now have an additional tool in your kit that you can use anytime you are feeling amotivated and procrastinating. Now, there are numerous examples I could give, and hopefully there are numerous examples that you're thinking about. The key is to have a short list of about 5 different effortful, aka painful activities that you can employ anytime you're feeling amotivated or in a state of procrastination, keeping in mind that the goal is not what you accomplish inside of that activity, although it is important that you actually engage in that activity. I actually have to make myself meditate in that 5 to 10 minute little bout of effortful or painful activity. But it's not about achieving an outcome. It's about forcing your body and mind into a deeper state of pain and discomfort. In other words, taking yourself from that trough that you're already in and steepening and deepening that trough. Because in steepening and deepening that trough, we know that the return from that trough to normal and even elevated levels of baseline dopamine is going to be faster and more robust. And in doing that, you will quickly find yourself back into a motivated state, because not only does it teach you that doing hard things is possible, that's sort of more of a subjective cognitive learning, but it actually taps into the very neurochemical system that allows you to then feel motivated and capable to pursue the larger goal, which is the thing you're really concerned about after all.